Hello, all, and thank you for joining us today. I have just started a recording of this webinar so that we can share with all those who have registered. My name is Brianna Routh, and I'm with Montana State University. I am an associate professor in food systems, nutrition, and kinesiology, as well as an extension specialist in food and family. And I'm excited today to share a little bit of some research and a project that a number of people across the country have been working on for many years. It's a part of the Rural Families Speak project. Rural Families Speak about resilience most recently. And this is a space where faculty and researchers can share a little bit of the work that we have been exploring with rural communities, as well as an opportunity to hear from all of you who are those working in the communities, especially rural communities, to see how many of these topics that influence families in rural communities might impact your work. We hope that this series is an opportunity to have a dialogue, but also share some of the latest research and how that might really apply to the work that you're doing with these families in rural communities. So today I'm very excited to be able to introduce a faculty member who's been working on this project, Heidi, as well as her partner John, who are going to share a little bit about working with veteran families in rural communities. And I invite you to stay with us. About the first half of this presentation, we'll be sharing out some of what they're finding, but the second half is an opportunity for us to discuss a little bit more. What are some of those strategies about how this might work in your work in communities? So please do stick around with us for that whole hour. You have the chat box as well if you want to add in any questions or comments. We'll have some time at the end to be able to address those as well. Thank you again for joining us. And without further ado, Heidi, I will turn it over to you.
Thank you so much. My name is Heidi Radunovich. I'm a professor at the University of Florida. And with me today is John Parker, who is a graduate research assistant who has worked with me on this project. And he is just like a breath away from being doctoral candidate. So yay for John. But I also wanted to acknowledge Michelle Parisi and Maria Rossi, who have been working also on this project. They are our collaborators who were previously at Clemson and now have moved over to University of Georgia. But a lot of this work was done during the time that they were at Clemson University. Uh-oh, here we go. All right, so what we're going to cover, we're going to start out talking a little bit about the military and veteran families. Then we're going to go into some of the research that we have done and some of the findings that we have, and then we'll talk about our next steps. So I'm going to go ahead and turn this over to John.
Thank you very much. Good afternoon, everyone. We wanted to start off talking about who is a veteran. And so basically, veterans are anyone who's been engaged in military service that has completed active service. They could be in retirement phase. They could have finished their contract and did not renew their contract, or one of the above, but now in the National Guard or Reserves, or finished service in the National Guard or Reserves. And they're also honorably discharged and are no longer able to serve. The demographics of veterans, currently veterans are around 7% of the US population. That declined from about 26.4 million in 2018 to about 18 million in 2020. Women only around 10% of veterans, but that number is increasing. And minority representation among veterans is also increasing. The median age of all is 65, but post 9/11, the median age has dropped down to 37, which is very interesting. There's a higher level of education, especially amongst younger veterans. And post 9/11 as well, people are more likely to have an injury than in previous years. Here we have a chart for you that's kind of brought to you by the census that shows the areas in which veterans populations are living. Most states generally hover around the 6.0 to 7.9% rate, but you can see different areas that are marked by the darker color blue that have 10% or more, but this is just a general overview of where veterans are located within the United States. And speaking of challenges for veterans, there's a lot of things that are going on that kind of present themselves as obstacles on occasion for some veterans. One is health. There's disability concerns, issues obtaining benefits, adjustment to the civilian life, especially for themselves and for their family, and if retiring, retirement issues. And when you compare rural areas to urban areas, there's a greater likelihood of poverty for those living in rural areas. There's more older adults. There's fewer doctors and specialists and hospitals and other health resources. And there are very, very, very many hospital closings just due to various reasons in those rural areas. And there's fewer options for housing, education, employment, and transportation. And obviously, in rural areas, things are further away, and one thing that is very important, that digital divide, there's a less high-speed internet that's available in these rural areas.
Great. Well, thanks, John. So basically, when we think about rural veterans, it's important to note that a lot of veterans choose to live in rural areas, more so than the general population. And a lot of this could potentially be because many veterans, many military service members come from the rural areas to start with. So if you're from originally a rural area, when you retire, you're possibly going to be going back there. So that totally makes sense. And so I think a lot of times people are not aware of what a high percent of the overall population veterans make up. So they're out there, they're in our rural communities. For this research, we were approached by the VA Office of Rural Health. They're really looking for ways to improve things for rural veterans. They're aware that the VA cannot do everything. And so that's why they're trying to figure out what can other community entities do to support veterans in the community. And they were especially interested in the potential for extension. And that was sort of why we originally started this research. In doing this research, we've worked with folks who are at Clemson University, now University of Georgia. And so we looked at people in 2 different states, both Florida and South Carolina. There were 2 parts to our research. In the first part, what we did was we did interviews with our rural extension faculty members. And the idea behind this, which I'll talk about a little bit in a minute, is to really see what is actually happening to begin with as far as extension out in the rural areas. Are we doing anything with veterans? Do you know what you're doing? Would you be interested in working with veterans? What kind of capacity do we have to work with this population? And then the second part, we did oral interviews with our rural veterans and their spouses. And we were trying to assess their health and mental health needs. So for the first part, at least here in Florida, we had 23 counties that were deemed rural, and we use the RUCC code of 4 or higher to determine rurality. And I know there are different ways. We went by county. It just wound up being easier because a lot of our folks are situated at county extension offices. And sometimes people live and work in different places and it gets kind of mushy, but we went with rural counties as far as where they were working. All of the 66 faculty members that we had who were working in those rural counties were invited to participate. We had a little under half who actually participated, and this represented 13 of the 23 counties. So what we did for this portion is we conducted interviews via phone. We recorded them. They were transcribed, and then we did content analysis. And what our county extension faculty told us, there were some issues that came up a lot in their communities. One of the things that came up repeatedly, at least here in Florida, was that a lot of our rural counties are poor. They have a lot of people of low income. they have fewer community resources. And so they're sort of dealing with trying to make the best of what they have in their communities. And this may have something to do with being in the South, and this may not be the case in other places. But a lot of our communities, even if they're not legally segregated, there's a lot of self-segregation among our communities as far as people choosing to live in different parts of town based on race or ethnicity. That seems to come up an awful lot. And so this has some implications as far as providing services and making sure that it's available to everybody. Another thing that came up was that our county faculty members really had no idea who their clientele were who were veterans. They did not ask. This was not something that they did. It wasn't part of their intake. And so this was just something that was sort of off the radar for them. They really didn't have any good sense of what the needs or experiences were of veterans in their communities, or what the needs would be for any sort of new programs that might be useful for them, or how to adapt their existing programs. And, you know, probably this is the case for everybody who works in rural communities and pretty much everywhere is we're all so busy, and it can be tough to take on something totally new. So you don't necessarily want to start all new programs or do something new. You want to sort of make sure that what you are doing is culturally competent for this population and that we're doing good outreach. There was one person who reported doing veteran-specific programming. This is someone who is in horticulture, and the VA asked them to come in and do horticulture therapy, but basically they just taught people how to work with plants. They didn't really know anything about the therapy part, but they were doing at least something with the VA. So there really wasn't a whole lot as far as interaction between extension and veterans or any sort of veteran entities in our counties. So my question for all of you, for those of you who are providing community services or are involved in extension, just wanted to check in and see, does your agency track the number of veterans or veteran families served? So if you all want to maybe put that in the chat box. I'm just kind of curious to see whether this is something unique for our state, or if this is something that is more common. It sounds like at MSUE, okay, so MSU Extension, you guys do track. That's excellent. Brianna says at Montana State, not that you know of, okay. Is there anybody else working in the community at Minnesota? No. Okay. So it's not just us, partially for Iowa State. Okay, good. So there are some folks who are sort of tracking this issue. Michigan State, good job. Excellent. SNAP outreach for veterans at Michigan State, great. Ooh, bonding through board games to veterans. Oh, I love that. That sounds so cool. And that's at K-State. Wow, well, this is great to hear. So I'm glad to hear that there are some states out there, maybe not everybody is doing this, who are sort of more on top of having veterans among the people participating in your programs, maybe even doing some specific outreach for veterans, which is wonderful. So the second part of our research involved doing interviews with rural veterans and their spouses. We did recruitment for this through Extension, 4-H, schools, libraries, local advertisements, including supermarkets, military museums, veteran groups we did outreach to, and then eventually we started here in Florida. We went to Facebook and Instagram to try to reach people, because let me tell you, it is not necessarily easy to get appropriate people to participate. We did have to do a lot of verification. We got a lot of scammers who were pretending to be veterans or pretending to live in rural locations, but who actually did not qualify for this study. So we had to engage in some strategies to do that. What we did for this is we did the interviews through Zoom, but without the video, because we wanted to keep it as anonymous as we could. But we were able through Zoom to use the recording function and transcribing. So it helped us with the transcribing a lot. We did have to go back and make some changes, but it got a lot of it through Zoom, and that really facilitated the data collection. We used a set qualitative interview, which we came up with these questions, these prompts. We did have a few follow-up prompts for certain things. And the things that we were really interested in finding out about were people's health status, what sort of health challenges they were facing, their access to health care and mental health care, and their mental health status and challenges. We wanted to know whether they had any kind of families. Did they have spouses? Did they have children? And whether their family members had any sort of access to healthcare, any sort of challenges that they were facing. And then the last thing that we threw in there was to get a sense for what sort of knowledge they had about extension. And that was something that we were really interested in, whether they were engaged in extension locally. So we wound up having a total sample of 125 people. In Florida, we had 37 veterans. In South Carolina, we had 62 veterans, and then we had 26 spouses across the 2 states. One thing that was really interesting, it was hard to get the veterans. It was near impossible to get spouses. You would think maybe the veterans would recommend their spouses, but many of them seemed really concerned about having their spouses involved in this study. So it was definitely a lot harder to get information from the spouses. But we did get quite a lot of veterans for a qualitative study. We had 79 males and 46 females. And considering that women are only about 10% of our veterans, that's pretty good. So I thought we had some good representation there among the females. As far as ages, as you might imagine, we did have a high number who were older, like the 65 and older. We had 63 of them. But we also had quite a few who were younger, in that 40 to 64 range. We had 46 people, and then under 40, we had only 15. But this just gives you a sense that there are a lot of veterans out there who are in that younger age group. I think a lot of people, when they think about veterans, they're thinking about people in their 60s, 70s, 80s, and that's not necessarily the case. We do have a lot of younger veterans, especially since 9/11. And, they have families, they have spouses, they have children. So as we're thinking about outreach to them and their needs, we have to also consider their families. We did content analysis using Atlas TI, and we had 2 coders coding the themes. As far as overall things that we were seeing among our families, we were really interested in this issue of access and what sort of access to services they had. One thing that we didn't realize as we started this is that just because you're a veteran does not necessarily mean that you qualify for VA services, especially among our younger veterans. A lot of them just did not qualify. They hadn't had the number of years in, or maybe they didn't have some sort of injury. Older veterans, the qualification for VA services in older times was different than it is now. So it's harder to qualify these days. As far as the happiness with VA services, there were some mixed reviews. There are some people who were delighted, they loved it, they thought they got good care. But other people had some difficulty. They felt it was really difficult to get into the VA services. There were a lot of barriers, and it was time consuming. Maybe some of their service providers weren't the best, or they weren't happy and they wanted to switch and they couldn't. So there were certainly some issues there. There were also some issues regarding transportation. And as you might imagine, in rural areas, there's not necessarily always a VA that is close by for you to be able to access, even if you do have access to VA services. So people would sometimes have to drive for 2, maybe 3 hours to get to a VA hospital in order to get services. And that's a lot. So for many of them, they actually had private insurance, which I was very surprised about. Many of them had private insurance through their jobs, because many of them, even though they had perhaps retired from military service, were continuing to work. So a lot were actively working and had private insurance through their jobs, which was a bit of a surprise for us. We did find that most people wanted care in their communities, and the VA does have a program actually called Community Care, which is the VA pays for it, but you can seek care in your community if you meet certain criteria. For example, if you live far enough away from a VA hospital. We did have a few folks who were not insured and did not have access to VA healthcare. So that made us feel really sad that there were some veterans who had no available health care. As far as the issues that were most important related to health, these were really the top issues that they were reporting to us were things like obesity and weight management issues, heart issues, heart health, blood pressure issues, and diabetes management. Those were the top 4. There was a lot of variety, and certainly there were a lot of people who had multiple and complex health issues. But we were seeing a lot of these things. And what was really notable to me is that in Extension, we tend to have programs that tackle these issues. And so to me, I'm like, wow, we have these great programs that could potentially be beneficial for our veterans from a prevention standpoint, either primary or secondary prevention. It might be really helpful for us to make sure that our veterans know about all these great programs that we've got. So that was something that really stuck out for me. There was some report of mental health issues, but I have to tell you, a lot of people did not seem to want to talk about that. There is still a lot of stigma related to mental health issues. And in fact, there was one interview where we were asking about, are there any mental health issues? And the veteran was like, oh, no mental health problems. And in the background, the wife starts screaming, yes, you have mental health problems. So I think sometimes it can be hard. Like people are much more, I think, open and willing to discuss their health issues. There can be more of a reluctance to discuss mental health issues, especially in rural areas. There is more stigma as well. So just something to kind of consider. There were several people who had children, and they reported that it was difficult to get services for their children, especially for specialized needs, children who had special needs like ADHD or other specialized health issues. It was really difficult to get services locally in rural communities. And they were just looking for anything that would be useful or helpful for their children. When we asked people in rural areas, our veterans, did they know what Extension was? Had they had any interaction? people really didn't know. It was extremely rare for anyone to know what extension was. Um, if they did know what extension was, their understanding was really like, oh, you get your soil tested, or, definitely more on the ag side of things than the family and consumer sciences side of things. So, I don't know that that's really a shock. Extension doesn't necessarily get the press that it deserves. But I think, especially in rural areas, it's going to be important for us to do more outreach to this group of people who happen to have higher needs, um, and are more likely to be in rural areas. All right. So as far as like sort of the take home message and some of the things that we got from doing this work is that it's highly likely that we have veterans in our programs, but maybe they don't even necessarily realize that it's extension. And um, some of us are not doing a good job of tracking our veterans, or are not necessarily doing specific outreach. It sounds like some states are doing a much better job than we are in Florida and in South Carolina. I would also say that, particularly in rural areas, we're not necessarily tapping into this audience. And I think that this is a good audience. These are people who have these needs and would be a good fit for many of our programs. And we might want to do a little bit more to try to tap into this audience, and maybe even try to take some of our programs and make them special for this population, like, healthy eating for veterans, or, something like that, where we're really sort of tailoring it to them. I do want to sort of emphasize that not all of our veterans are elderly. We do have many that are young and have families. This is a population with higher health and mental health needs than the general population. So it is especially important for community providers and community educators to do outreach and serve this population well. So as far as reaching out, I think that there are veteran liaisons in most counties, and this is a great way to do some sort of reaching out. There are also veteran groups and organizations in most counties that would be good to reach out to. If there are county veteran services, this is another great way to reach out to this population. Advertising with local VA services can also help. So those are just some, just throwing out some ideas of ways to increase outreach to this population and find this population. As far as some of our next steps, we are working on doing some training modules for our folks in Extension, to try to help them better understand this population so that they will feel more comfortable and confident in doing outreach. We're also going to be arming them with some handouts and resources. Right now, the way we have it set up is that we're going to have some brief modules on different topics that people can really just pick and choose which ones they think are going to be most relevant to them. But because this was something that our county extension faculty members related to us, that they really didn't feel like they knew much about this population, they didn't necessarily feel comfortable doing outreach, we wanted to make sure that we did this. So this is something that we are working on right now. All right. So as far as questions, I see that there are already a few comments in the chat box. So Michelle, you mentioned that it's interesting to you as a veteran spouse, and I think that this was related to the fact that it was tough for us to get veteran spouses. The sense that we got was that the veterans were actively trying to prevent their spouses from participating. We thought, oh, if we get the veterans, we can say, hey, your spouse can participate. We thought that would be a good way to recruit. But for whatever reason, I don't know if they were worried or trying to be protective of their spouses or whatever, but there seemed to be a bit of resistance to recruiting their spouses to participate. And I don't know if they were afraid of what their spouses would say about them, or, maybe they were concerned about that. I don't know. But it was definitely challenging in both of our states to get those spouses. Someone said getting assistance for neurodiversity is difficult to get anywhere. Absolutely. And in rural areas where you have less of everything anyway, even more so for sure. At University of Minnesota, I work with our county veteran services offices, the disabled veterans, MACV, etc. And I think that that's great. So those are some great places for doing outreach. And I'm so thrilled that so many of you are already have specific programs out there. And I'd love to hear more about some of the things that you are doing. And maybe when we move to our chat, that is something that we can kind of talk about and give people a chance to talk about that. Okay, Michelle says, I wonder if there's a correlation with the veteran age. My husband would prefer that I participate, but you're in your 30s. Yes, absolutely. We were paying participants. So, we actually told veterans like, hey, you can double your money if your spouse participates. But I think you're right. I think probably older veterans were maybe somehow less wanting their spouses to participate, but maybe for younger folks, they would be more amenable. So that's really an interesting thought. We had not considered that. So thank you. I appreciate that. Does anybody else have any questions or comments?
And I will just add, thank you so much, Heidi. And John, this has been a really important and enlightening presentation. We will, we're going to attempt to go into breakout rooms here. So there may be some more questions and comments that come up in these smaller discussions. As I'm giving just a moment to see if anyone has a burning question for Heidi and John as well. Oh, that one popped away. How do you develop trust with this population? I don't know, Heidi and John, do you have some ideas that you might be able to share initially? But I think that this is a great question too, to bring back to the group to see what's working in different states and communities.
I think that it's difficult to build trust with most groups, especially if you're not a part of that group. I would say getting buy-in from specific stakeholders would be beneficial. So I might approach some of the veteran groups and then ask the question like, hey, we're doing this. What do you all need? Is there anything we could do for you? Maybe we could do something closer to where you naturally are. Are there any specific programs that you would like to see? I think asking them what they want is definitely going to be helpful, and doing outreach. But you're right, it can sometimes take time to build trust with a new population that you're not used to working with. But if you can find maybe one or two people in there who you can build some credibility with and who will say good things, and can then go back to the other folks and be like, hey, I went to this really awesome diabetes program through Extension. You guys, it's really, wonderful. That can sort of help as far as, increasing your credibility with that population would be my guess. But yeah, Michelle says it takes time. Absolutely. I think, it's not something that will happen overnight, but this is a really important population that needs help, that needs services. And I think it's important for us to do what we can, and to try to at least start the process. And honestly, it sounds as though there are several states already where they're doing some really veteran focused programming that has been successful. So I can't wait to hear more about that when we go into our groups.
So I believe, and I am attempting to pull this up before we go into our breakout rooms. I'd love to just have a few questions for you to answer. Heidi, if you, oh, I think people are seeing this and able to respond. If you go ahead and take just a moment to respond, we're just asking about this presentation so far. Again, please stick around because we are going to break out here and have a little bit more discussion on this topic. I will give just a moment thinking about how this presentation might have supported the importance and significance of working with veteran families, especially in our rural communities, for the work that you might be doing. We so appreciate you taking the time to join us today and look forward to seeing you in future webinars on a variety of topics of how we might best serve rural families. Thanks so much and have a great day.